children, you have children yourself, not just as a mom, but as a clinician. So you're experiencing both ways. And I know we'll be able to shed so many lights on gray areas that parents will want answers to. I believe some parents will be joining this evening, and as soon as they join, I will encourage them to share their questions. And as they share their questions, I will direct them to you. Thank you once again for coming, Jay.
Thank
All right.
you.
Before we have questions rolling in, I'll start by asking you some few questions if you do not mind.
Okay.
Um, so our audience already know who Jennifer is. She's Dr. Jennifer Micah or Dr. Jennifer Ojeba. Which one do you prefer, Jennifer?
Honestly, so I'm just answering by that's thing just because of my documents now, but
Yeah,
it's for my camp now.
Micah. Okay. So
Mm.
you're welcome, Dr. Micah.
Thank
So Dr.
you.
Micah, as we already know, is a GP here in the United Kingdom, Somerset, and she's currently in training. She was initially in doing her uh, training in Nigeria, community medicine, Federal Medical Center, Yenigua, before she moved to the United Kingdom. And she's very experienced and she'll be addressing our concerns. And we're going to talk generally. It's not just going to be a one-way question and answer thing. Um, Parents will still hope to hear your answers on some questions and what you think about some certain things. Okay. So go ahead and ask the first question, Jennifer. As a mom of four, what is one feeding struggle you faced with your children?
Well, thank you, Mary, and thank you for the opportunity, first of all, to be here. This is the first time I'm going live myself, and when you called, I was like, okay, why not? If not, at least I'm not going to be talking to those who are perfect, who knows how to do it all. I'm going to be talking to those who are imperfect mom like me, and who are still trying to go through the changes and the struggles that life bring each day. So I have twins that are 4 year old and they're still like under five, and I have a 6 year old daughter and I have a 7 year old special needs son. So of course, I will definitely have feeding struggles and challenges. So I think the only child I really don't have so much trouble with is the 6 year old, but she doesn't like veggies at all. So incorporating veggies in our food is really difficult. So the first challenges I had with feeding was spicy food. So with my that was let me start with the first one with my special needs son. He smells before he eats anything. So anything spicy, he will not eat. Anything that smells off, he will not eat. He wants to eat blank food. So I started the mistake of cooking a separate food from everybody. So they we're all eating separate. So I have to cook 2 meals for each food I cook. Then he wanted things that are smooth. So I had to start blending everything, blend carrot, blend this. And that was my initial first challenge. After a while, my husband was like, we can't continue to do this. Everybody has to eat what everyone is eating. So we started incorporating the spicy food gradually. So not so spicy, just okay that you know that the child can tolerate. So we started introducing gradually, but we try to use those meals that he loves. Like he likes to eat rice and he likes noodles sometimes. So we'll put, and he loves veggies. So he was one that loved veggies. So if you want to give him anything spicy, you can use noodles and put all the veggies and everything in it, and he's going to take it. So that was the first struggle. Then the next struggle came with the twins. And the twins, they don't like to eat. I don't know the reason why, but they don't like to eat. They can stay and they'll hardly even request for food. So I will have to be the one. So I do morning, afternoon, and evening main meals
Mm-hmm.
first. Then we try to put snacks in between. We try to avoid grazing. Grazing means eating a lot of frequent meals in between meals. We try to avoid it. So when it's time for breakfast, is breakfast. When it's lunch, is lunch. When it's dinner, is dinner. And we didn't used to do snacks before at all. We didn't used to do snacks or junk food while we were in Nigeria. But when we came here, we started adding some of the junk food, maybe because they are cheaper to get, or sometimes just want the kids to have a little sweet tooth. And so we just started getting them here. But before, we didn't used to do junk meals.
Okay.
Then also for the twins, I've started incorporating, like my one of the twin boys doesn't like egg, doesn't like veggies, doesn't like anything, just fluid water, just want to
Mm.
drink all the time. So with him, I just try to give, I still fry the egg every day for him. I still fry his own.
Mm.
Some days we win, some days we don't.
Mm-hmm.
So one thing I just tell myself is don't pressure yourself. I don't
Mm-hmm.
want to put myself under any pressure or make myself
Mm-hmm.
anxious about it, but I try to check his weight to know that okay, is he eating? Is he able to open bowels? Check most of the signs that I know as a doctor that okay will
Mm-hmm.
be a concern for me, that will be the reason why this child is not eating well.
Mm-hmm.
So my advice is that to mom who are struggling with children who are either picky eaters or finding it difficult to feed, find out first of all if they have a medical condition that is preventing them from eating. So then that will make you walk towards that direction, like having a special needs child, maybe a child that has a problem with his throat, you will not know. I even found that my son had a swelling, a laryngosile at his throat, this second twin, and not so sure if that's the reason he does not want to take solid food, but I just put it all down to that a little bit, then try to make his meal more watery
Mm-hmm.
and more watery so that at least he can be able to swallow. Then the new one we started was
Mm-hmm.
eat and drink, because if I give him egg or potato, it tends to like act like as if he wants to choke on them. Then it just all he has to do is just cough and the food will come out.
Mm-hmm.
So so I'll have to then just give him the food, give him
Mm.
water to drink, give him food, give him water to drink, so
Mm.
that he is able to put the food down. But
Mm.
I've still booked for him to see a specialist, so we're waiting for them to call us to actually know the reason
Yeah.
why he's struggling with feeding,
Mm.
with eating solids. Then
Mm-hmm.
for Jessica that doesn't like veggies, I'm starting with carrots, sweet
Mm-hmm.
corn, which she's tolerating gradually. If I tell her, okay, it's carrots, but she doesn't want the green veggies, she'll take fruits.
Mm-hmm.
Then I stopped doing pack lunch for her to school. I used to do pack lunch before. I I wanted her to join with her schoolmates
And
to
eat
know
then,
to
yeah.
know and eat everything that they are eating.
Mm-hmm.
So for her, she's now eating in school. Till now, she comes every day, mommy, pack food for me. I want to take food to school. I want my own
Yeah.
lunch bar.
Mm.
And I'm like, you have to eat what everyone in school is
It's
eating.
eating.
So
Mhm.
so my
Yeah.
next so we started that last term. So hopefully the next school parents teacher meeting, I'm going to find out how
She's
that is
okay.
going with her to know if
Mm.
she's able to still take the veggies. Before, when she comes back from school, she's always very hungry. So that will show that she's not eating. She didn't
Mm.
eat lunch well. But now she's not. She's not ready to eat almost immediately. So that means she's eating the food they give in school now.
Mm.
So she's
That's
not
good.
ready to eat immediately she comes back from school. So there's
Mm-hmm.
progress,
Yeah.
and they look healthy. So back home in Nigeria, my kids were always sick. So I don't know whether it's water or due to food. But here so far we've not had any serious illness that I know that has to do with them not eating well. So so far so good. I think
Mm.
the best thing is just don't put yourself under pressure as a parent.
Exactly.
Every
Yeah.
family is different,
Mm-hmm.
and then just try to find out what the child needs,
Mm-hmm.
what the child is lacking. I still notice that Joel does not like normal milk. Whenever it takes any food that has milk, he's going straight to the toilet. So we had to
Mm.
change his milk to slim to the skim milk,
Skim milk. Yeah.
which has helped him too. Then also in all of this, sometimes you just know at the back of your brain as a mom that you might not be giving all the nutrients somehow. So I give well kid every day, almost every day. I try my best to get them. I give well kid almost every day. They don't like tablets or anything, so they won't swallow any drugs. So I don't even try to force them to. And another thing is don't force them because any food you try to force them to give, that's
Mm.
the food they'll tend to hate.
Yeah.
That's the food they
Okay.
tend to hate over time. So I don't bother myself with that. Then, like today, I was able to give them Gary. When it's time to eat the bar, I almost put everything
Mm.
in one plate and feed. I still feed my kids up till now. I
Okay.
still feed them because most, especially the twins that don't like to eat. So they just sit down, look at the food, and they give you this statement like, yuck, yuck, I don't want to eat this, I don't want to eat this. And I'll be
Typical
like,
kids. Yeah.
and I'll be like, this is what we have. This is what we
Yeah.
have today. This is the food available, and no other thing is available
Mhm.
yet. And they'll be like, okay, okay. And then you have to feed. No, no problem. I don't have problem feeding you. I will feed you as fast as you are going to eat. So I still feed
Yeah.
them.
Mm.
So then if they are sick, of course, feeding is going to be reduced. If
Mm.
they have swollen tonsils, like you might see a child not looking so well, they'll definitely not eat well. If they have oral problems, dental problems, they'll definitely, especially the ones changing teeth, their teeth is shaking. So you have to just watch to be able to notice this thing as a mom. I know it's very difficult to continue to pay attention all the time, but I pay attention to my kids all the time, every
Mm.
little changes. And as a doctor, I have to work less just to make sure I spend more time. I spend 60% of my time with my kids and 40% at work,
Mm.
just to make sure that I'm able to be part of their growing and understand what they are eating. And
Mm.
we don't eat out. We don't eat out, so I don't think they'll even be able to eat any food outside.
Wow.
So we don't
Okay,
eat out.
Jenny.
I cook
Yeah.
all the time.
Yeah,
So that's how we do food.
yeah, you've been doing quite a lot. From what you've said so far, you really invested so much on them, and you've been very, very patient with them. My second
Yeah.
question was on how you handle them when they refuse to eat, and you've, you know,
Oh,
explained
okay.
that you do not push them, you just allow them be, you try to encourage them, which will be our advice to all parents out there today, not to push your children, not to force the food down their throats. I know there's temptation to,
Yeah.
that's that temptation to get angry. You must eat it, take it, you know. But I'm glad you have let the word out and you've advised everyone to be careful. Don't push them, encourage them, and gradually they will start adjusting to it like your kids have done. Thank you very much for answering that question beautifully.
Thank you.
Also, the other question was supposed to be how you balance healthy meals with busy schedules.
Hmm. So, right now, not back in Nigeria, right now, I'm not as busy as I used to be as a doctor. Uh, Back in Nigeria, I had like two, three jobs and could
I
juggle. I
remember.
had people around. I had people around to help. So
Uh,
then meals were being prepared. But now I have more time. I work less than full time, so I spend more time with my kids. So I'm able to cook. I do a lot of veggies food. Even when they don't eat, I still cook the meal. We get to throw a lot of meals away, but I still cook cook the food for them. And
mm,
and sometimes I'm like, okay, just try. I will cook the veggies, put everything in the food, and I'll tell them pick it out if you don't want to eat it. So in my head, back somewhere in my head tells me that the spice, the ingredient or the taste of the veggie are soaked with the rice. So of course they can pick
Exactly.
it off
Yeah.
and they'll eat, and you'll be surprised. Maybe one or two that have melted can enter their mouth, and sometimes they even try to spit it out. And
Mm,
as in my kids can be so dramatic with food when they don't want it. Like
mm,
they are ready to throw up that food when something not they don't want to be in their mouth. Like even
yeah.
if the chicken is hard, I do soft chicken. Like I thank God for UK chicken is really soft.
Yeah.
So soft chicken for them to be able to swallow. Sometimes I don't even fry their own chicken. I just boil it
Mm,
and just give them soft chicken for them to eat too,
yeah.
which is actually very helpful in with the struggle. But
Yeah. Thank you. Thank you, Jennifer. You're really doing well. When you said your kids do pick out the veggies, I also remember mine. Because that's what they do. When I make fried rice and they tell you they don't want fried rice, and I'll just tell
yeah,
them, please pick out all the veggies and eat the rice alone, and they're happy and they're picking out the veggies. I think that's
veggie, yeah.
what we most times we moms do, just to encourage them to eat, pick out the veggies and eat the rice if that's what you want to do.
Ones,
Then
yeah.
yeah, then another thing I would advise to add to how to balance healthy meals with busy schedules, if there's more than one adult in the house, everybody needs to learn how to cook in some way. So if one
Oh,
person is busy, another person should be able to help out. It shouldn't just be one person. The day the one person is not available, does that mean that there will be no healthy meal in the
no
house?
way, do you mean?
So yeah, so
Okay.
this advice is not just to the women, it's also to the men. And if there's any other relative in the house, everybody should learn how to cook. And while we're bringing up these kids, we also teach them how to cook. So if that adult that knows how to cook is not in the house, another person will be able to fit in and try to make healthy meals. All
Yeah,
right.
on that,
Yeah.
I'm very, very, very lucky. My husband can cook very well, can cook much, much better than I
Beautiful.
do. So
Oh wow.
I don't, so he cooks all the veggies and make sure he gives them
Nice.
everything.
Good.
And with him, they don't have problem. With him, everybody feed themselves, even both of the twins.
Wow.
Unfortunately for me, with my husband, as far as he's at home and
Hmm.
he's the one in charge, they all feed
Yeah.
themselves. They will
Oh.
eat and eat their food. But when it's me, I don't know what the
Talk about
what
the
the
main
difference
factor.
is.
Talk
I don't
about
know
the
what the
main
difference
factor.
is. I don't
Yeah,
know what the
that's
difference is till
that's the
now.
man
Like,
factor.
so
you
I'm
you don't
very
you don't have
envious
you
of
don't have
him
the
on
both
that.
face.
Yeah.
All right, no problem. At least we are glad
So
someone is there that helps them to eat without so much
yes,
stress and pushes. Yeah,
struggles. Yeah.
yeah. So we'll go to another topic generally. We're going to be talking about sleep. We've observed that some children find it difficult to sleep. You know, either they're going to bed late or they can be on the bed, they're not waking up, they're not sleeping on time, or they are sleeping and having problems with breathing. You get there and you
Yeah.
probably see your child snoring so much or not breathing at all. I don't know if you've ever experienced this in any of your children. What did you do? How did you handle it?
At least you know very well that it's your house I used to land. So so Joel growing up, he was sick every other month. So he had a croup most of the time. So if I notice that he's not able to breathe in his sleep, I just I go to see the ENT doctor. If I see if it's something I can't handle initially, maybe I can try to give some medications at home, paracetamol. I'm not able, I'm seeing that okay, I'm not winning. I'll just go to my colleague's house. That was back in Nigeria. But since we came here, he has not fallen sick at all since we came to the UK. He has not fallen sick at all. He has not had any respiratory infection. As in, definitely not worried about his health at the moment. But he struggles. Sometimes he does not want to sleep alone. So that's his main problem. He does not like to sleep alone. He always wants to sleep with someone. So that's the separation we're struggling to deal with. But my other kids sleep well. They sleep early when you tell them to sleep and wake up. So bedtime is 8 o'clock in my house. But this last holiday, the thing has destroyed. So I try to go back again. One thing I don't do myself is that anything I don't win, I don't worry about it. If anything I'm not able to do, I don't let beat myself up about them. I just live for the next day. I'm hoping that it will change. So lately, to just stay waking up at night and he will scream and he will shout, and I'll just console him, hold him, then he will sleep off. Then we'll take him back to his own bed. He'll wake up again on his bed and notice that he's alone. He will scream and shout again. He will continue on my bed to sleep, which affects my own sleep. But we're just trying to make him learn how to, because he's 7 now, so we're trying to make him learn how to stay on his own. My twin boys, the girl, every other person can sleep alone on their bed. I don't have problem with them, just my son who is autistic.
Okay.
But
Yeah.
oh,
Yeah, at some point we need to learn to let them have some independence and let them help themselves, because um you get to a stage as a mom, you just want to give them that free hands to see how they do. All right, thank you very much for answering that
yeah,
question intelligently. So what we do generally, if we have a child that's finding it difficult to breathe, to sleep, like she has said, we can set out a sleep routine. For Jennifer, she makes sure her kids go to bed by 8 p.m. That's a very good routine. And if you're unable to achieve, at least at most, they should be in bed by 9 p.m.
before 9, yeah.
Before 9 p.m., they should be sleeping before 9 p.m. If it's the one that finds it difficult to sleep, gets into the bed, finds it difficult to sleep, make sure the lights are off. Some people are very sensitive to light and will not be able to cope with the presence of light in the room. So make sure the light is off. Now, for those who are finding it difficult to cope with noise around, make sure there's no noise around as much as possible. And then for those who have problems with snoring, I've done a video before on snoring. If you have a child that's having problem with snoring, you have to do something about it. It's really not normal for children to snore. So if you have a child that is snoring, you have to take the child to see the
Serious.
ENT. So Jennifer was saying that when she was in Nigeria, she was always coming to ENT. She was always coming to my house. Especially when the child had problem with breathing. So if your child has such problem, see an ENT, let them check what is going on, and they'll be able to
Yeah.
provide solution to help your child. Okay, thank you very much once again, Jenny.
And
Let's
another thing I wanted to add is if the children don't sleep early, they find it difficult to wake up, especially school period, and they'll be very
exactly.
cranky.
Mm,
So it's really very helpful when you try to make them sleep early so that when they wake up in the morning, they are like ready to go to school, not telling you, dragging their feet, I don't want to go to school and all that.
mm,
But when they sleep on time, they'll sleep well. And no watching of no screen time like an hour or two before bed.
beautiful.
So it's very important. They said I think that's has like whether this regulates the brain settling or mechanism or whatever. So no screen time before 2 hours before bed.
Okay.
That is very helpful. It will reduce the activity in the brain for them wanting to do stuff all the time. So then if there's no rush, if the children is having separation issues, they can start with you, sleep off, then you can take everybody back to their room. And most of the time, we pray on our bed. So they pray on the bed. So immediately we pray, everybody sings, do that. Next thing, the prayer starts. And by the time you are done with the prayer, some people are already sleeping.
Mm,
So, which is also very helpful.
very helpful. Yeah. So my last
Mm.
child still has separation issue. He's
Yeah.
always in my bed. This young man will sleep off, and then I'll carefully, or the dad will carefully carry him to his bed to sleep. As soon as he wakes up in the middle of the night and looks around, he's not on my bed. He's coming, or he's looking for a room. And then you start
Yeah.
hearing this tap on the door. He's there. Okay, so I think there are children like that. They're just very, very much attached, and they can't sleep alone, or they can't sleep when their parents are not there. But especially at this young age, you might give them some free hand, but at the point a point will come that we'll have to draw the line. Sleep in
Yes,
your
yes,
bed.
definitely. Sleep in your bed, yeah.
Yeah, sleep in your bed. All right, Jenny. Thank you very much so far. I don't know. We have people in, and I'm not seeing the questions. Hello. We have. Oh, okay. T is here. T, we're happy to have you here. We are happy to have Mr. Jacob himself. You're welcome, sir. Good to have you here. And we have our mommy in the house. Good to have you, ma'am, Mrs. Celestina Ojigba. Good to have you. We have confidence as well in the house. Good to have you too. Um, we have Mrs. Joy Oko. Mama, good to have you. So we have a lot of persons here. If you have any question, please just drop it. And our special mom here, our clinician here, will answer your question. She's very smart and intelligent. Thank you very much. So we'll move over to the next question. As a mom, we've all been there, having sick children. Suddenly there's a temperature. Um, how do you react when your child has got temperature? How do you react? How do you feel? How does it make you feel? And what do you do to help?
Yeah, as a mom, scared, especially with fever. Like I've seen children convulse. I've seen how children decline in the hospital. I've worked in pediatrics units and I've seen changes. So most of the time when my kids have fever, back home, really scared because the fever, it just does not end with fever. Next thing they're vomiting, they're not able to eat, they're not able to do this. I'll try home remedies. I even try to do lines at home, but and if it does not help, I'm on my way to the hospital. Then, but yeah, I've understood the fact that there's no need to rush so much. You can do with the paracetamol and ibuprofen, and um, there's so much. Maybe because of I don't know whether it's more confidence in the system or for the fact that they're not too quick to even give you that thing you're looking for. So you have to
Exactly.
work with their guidelines. Yeah, so
Yeah.
so when my kids have fever, yeah, I just give the paracetamol. General the four I make sure I do the 4 times a day so that the fever does not reoccur. I make sure I do the 4 times a day. And if the 4 times a day is not working, I do the ibuprofen. I'm usually very scared. I find it difficult to sleep. I just stay by their side and don't know. I'm just so scared of seizures. I don't know why, but at the back of that, I'm really scared of febrile seizures. So I'm always with them. I just stay with them. I have a thermometer in the house to be sure that I know the kind of fever I'm dealing with. So I think every mother, every home should have a thermometer in the house. It's
Yeah.
very important. And every home should have paracetamol. I know I've heard of people that say they don't take drugs, they don't have paracetamol at home. But if you don't have for yourself as an adult, just for the sake of the children, we all have faith, we are Christians, I agree, but just have that's the minimum you can do. Have paracetamol at home because it will save you a lot. Because even if you have to go to the hospital, even when you say the system is, oh, you have a little confidence, by the time you get to it, nobody's going to attend to you almost immediately. So, but that paracetamol you have given is going to go a long way. So, give that paracetamol, then observe, watch some of the fever. Like immediately that fever is more than 3 days. I don't see why you're still keeping the child at home, especially when they are below 5 years old. Sometimes if it's not, except the temperature is not so high, then you can wait till like I know I've waited once till after 5 days, and I'm like, this temperature is not going down. And I just got one of my tools and checked her throat, and I saw two enlarged tonsils with white
Was
exudate and everything inside. So I
mm,
knew I was like, oh no, we have to go. Then I called the GP immediately, and they booked me immediately because they
yeah.
knew that I understood what I saw,
Mm,
and we started the antibiotics in an hour in a day and a day and a half or so
yeah.
she
Better.
was fine better again. So
Mm,
you just watch the signs. But if you are not a medical person and you're not confident enough, just
mm,
go to the hospital. Even if it's 1 day fever or 2 days
mm,
fever, go. Let
mm-hmm,
them encourage you and reassure you and tell you that okay, we're not concerned
mm-hmm.
about this, or we did blood tests and blood tests are fine. For us, the only reason why sometimes we're able to keep at home is because we're medical professionals. But if you're not and you don't feel that confident in yourself to say, okay, this child has fever, I encourage for children, especially under 5, even under 10, please just
Mm-hmm.
go to the hospital. And
Mm-hmm.
if you're not confident, just go to the hospital. Let them take good care of your child. And for children, they have low threshold for giving appointments for kids. If a mother is complaining about their kid, they give you that appointment that you need, either your GP or your
Mm-hmm.
urgent care or ED. In Nigeria, if you even contact any doctor or pharmacy anyway, they will attend to your child. We've worked
Mm-hmm.
in Nigeria tirelessly. It's
Mm-hmm.
open 24 hours. And so sometimes in Nigeria, I see some parents complain that, oh, I don't want to go to FMC. A lot of people have their child unwell and they said, oh, no, I don't want to go to FMC. No, you are not going to join that adult crowd. The adult crowd is different from the children
Children's
crowd.
department,
You go
yeah.
to the children department area, and if it's an emergency, it will be treated as one. If
Mm-hmm.
they are not attending to you almost immediately, you know that it's not an emergency.
Mm-hmm.
Even here, if they're not attending to you immediately, don't worry. Everybody's seeing you. Everybody's concerned. It's
Mm-hmm.
not an emergency, and you can be on the line with everybody.
Mm-hmm.
Don't be. You won't be scared because you know that you are in a place of safety.
Mm-hmm. And
So, but
you've
so
probably tried your child and already know that
triad your
this child,
child
this
exactly.
is when we can see this child. Yeah. So Jennifer, I want to say something. You said when you were in Nigeria, will you say, okay, let me not go in that direction because I want to just raise a point, but I just realized that in Nigeria, while we have too many frequent episodes of fever with our children, most likely because of malaria, which we do not have here. Because most times in Nigeria, when our children are sick, most often
Yeah,
it's usually malaria. When you do a test, it's malaria. So I think we have malaria over there, and we do not have malaria here. That's why we have more frequent
more frequent.
fever episodes in our children in Nigeria than we have compared here to here. Over here, it's more
But
of viral illnesses,
illnesses, yeah. I think mine
cough,
was different. Mine was
runny
different. It wasn't
nose.
even the malaria per se.
Yeah.
It wasn't the malaria per se. I stayed in a house that the water source was bad.
Okay.
So is the water source was we don't drink it at all.
Mm.
So, but because they are kids, when they bathe, the water can go into their mouth. So immediately, sometimes they just go and they take the water, and we get to keep water, like because you are having water storage, so there's
Mm.
water everywhere. So I felt all the time because it's almost water related because the others start with vomiting, diarrhea, vomiting,
Okay.
diarrhea. So
Okay.
it was the water source because I noticed even my other colleagues that were still in the same state with me were not
Mm.
experiencing the same problem. But
Okay.
we didn't move out immediately because we just felt okay, we'll leave the country soon. So we just so that's why they were
Mm.
sick every other month. They were sick every month. So
Mm.
it wasn't funny. So we're almost at the hospital all the time. It was because of
Mm.
the water. We tried to do everything to remove the water, to keep the water clean, all the
Mm.
filtration mechanism, and it did not work at
Mm.
all.
Mm.
Immediately we came here, the water is good and every so we didn't have that challenge anymore.
Okay. All right.
Mm,
Thank you very much for clearing
mm.
that up. You were mentioning about febrile convulsion. You said it made you very scared. Has any of your child had febrile convulsion before? So why are
No,
you just
uh,
scared?
my younger brother has had febrile convulsion
Oh, okay. So there's
before.
family history of febrile convulsion.
Yeah,
I
my
get
younger
why
brother
you.
has had before. So,
Okay.
and
I get why you were scared. Yeah. So it's very common. So for mothers here and that parents here, just know that febrile convulsion is a convulsion that occurs following fever. If your child has got temperature and the temperature is beyond 38 degrees centigrade, especially children who have family history of febrile convulsion, the tendency for them to convulse is very high. So if you have a child and your child is spiking temperatures and you know that there's family history of febrile convulsion, try to make them comfortable as much as possible by giving them paracetamol, giving them ibuprofen, and just to help the temperature come down. Um, okay, that's about febrile convulsion. We do not want to go deep into that. But if you
into
have
that. Yeah.
questions, just drop it in the comment section. Thank you. Now the next question: what signs make you decide? No, what signs make you decide it's time to see a doctor? Okay, yeah, I think you've said that already. If the
Mm.
temperature is persisting up to 5 days, and it's not remitting, like your child was having temperature to like 5 days and it wasn't remitting and the rest. Okay. Now, I want to ask this question. In the beginning of this discussion, you already told us that you have a special needs child, and I believe you're very comfortable in answering this question, right? Have you
Yeah.
ever worried about your child's behavior or development?
So, for my son, I was worried from the day I gave birth to him. Not because I felt, so he didn't cry immediately. I didn't have any problem with the pregnancy. Pregnancy was fine. So, but he didn't cry immediately. And we had to do all the, try to resuscitate him. And he had very low APGAR score, what we call the score we give children. So since then, I've been worried. Every time I'm looking, I'm like, okay, my child should not get cerebral palsy. My child should not get this. So I was always watching him. But at 4 months, he sat. He was very energetic child. He's a very energetic child. He sat at 4. He crawled at 6. He walked at 9 months. He started saying words at 10. So I was like, okay. So we're doing great until after I had my daughter. Then he stopped talking. Everything just stopped communicating, but it was still energetic, was crying or speaking, started crying all the time. So then that's why from there things started changing. I took him to the pediatrician almost immediately, and they said maybe it was the separation thing or neglect because I have another child. That was why. So that was where the whole him always staying in our room started from. So while I was even carrying my daughter, I was with him more. Like I only carry my daughter to breastfeed him, and I'm carrying her all the time just to be sure that okay, he's fine and he does not feel neglected or have any issues. But the speech wasn't coming. They said, okay, put him in school early. When he sees his mates, he'll start talking. We did that. Speech wasn't coming. It's just screams and blabs and stuff like that. So, and I just knew from the beginning that there's a problem. So I spoke to the neuro pediatrician and she was like, okay, this is autism speech delay and we don't know which it is at the moment, but let's just watch. Then the banking of head started, the eating abnormality started, the smelling of food, and it just one step, like
Mm-hmm.
each day different things just stay coming up. So then after that she started when he became very restless, he wasn't staying in a place. We did the it was 4 then, but the speech had not still come. And she was like, let's try methylphenidate and
Mm-hmm.
see if it was going to help. We did that for some months and it was making him calm, but we wanted him to talk. So the
Mm-hmm.
whole blabbing and screaming he had able to achieve, they stopped.
Mm-hmm.
So we're like, okay, no, we don't want calm anymore. We want this speech to come out. So we had to stop the medication and just wait for the voice to start coming up gradually.
Mm-hmm.
From when he was small, he was able to, then he started singing.
Mm-hmm.
Singing was good. Singing was good, encouraging singing. So singing was good. From singing, the whole behavior started. It was now difficult to keep in school, but the school really tried. It was a Christian Nigerian school, and they were very helpful then. They took good care of Joel. They prayed for Joel every day with us. They were very supportive. They taught him, and he learned how to write. He
Beautiful.
learned how to read, and they were teaching him like a normal child. He was not in class all the time. They allowed him to play. The whole class, school
Mm-hmm.
was aware of him, and everyone took care of him. They were
Mm-hmm.
very helpful.
Mm-hmm.
Then we came here. Then that was when we knew that okay, is more difficult than we thought it was. As in, it's worse than how we thought. In this place, anything just away from the norm, they
Mm-hmm.
cannot tolerate in school. So but even though even though he could read better than his peers and he could
Mm-hmm.
spell better than his peers, he could
Mm-hmm.
like he could draw, his writing was good.
Mm-hmm.
They still did not think that it was okay for him to be with school with other children because they
Mm-hmm.
felt he was a danger to other kids and a danger to himself.
Mm-hmm.
The banging, the refusal to do things, so that was where the journey started. So
Okay.
yeah,
Thank you very much for sharing these details. Thank you very much. So I just want to let us know, parents, like what Jennifer has said. She's told us her stories, which are very, very quite emotional. But then you can pick lessons from there. She identified it very early. As soon as it deviated from normal, she identified it. That means she was paying attention to her child. She wasn't carried away with the newborn. She immediately noticed that something was different from what it used to be. And as soon as she noticed, she didn't sit at home. She didn't cross her hand and say, "Oh, I'm a doctor, let me rest." No. She went to seek for help. She went to meet a pediatrician
we
and she
also did
sought for
speech
help.
therapy. Yeah, we also
Yeah.
did speech
So
therapy in Nigeria
hmm.
too. Yeah,
Yeah, so she sought for help. She met the relevant pediatrician, the neuropediatrician who was helpful. And then she took the child to a good school. And also we got school support as well. So the child that was not probably not talking or not singing gradually started singing, gradually is able to read, is able to write. That was the support the child was getting. So this is generally to all moms. It doesn't matter what you are struggling with your child, you have to be available, not just to the mom, to the dads as well, because I know that Joy's dad is doing a lot for him as well. That's why
yeah,
we've gotten all the positive responses, positive behaviors we're seeing today, the writing, the reading, and the drawing. He's a very good artist. So he's got support, strong support from both parents, from those around, especially community back home in Nigeria. The school was very supportive. The speech team were also very supportive, and I believe here he's also getting all the support he needs. So this is just a lesson to every one of us as parents. Be very observant of your children, and as soon as you notice something deviating from the usual, please seek help as much as possible. All those around you, people around you, will be able to help. And I'm
yeah.
glad that we have positive behavior. We can tell a lot of positive things that we can share about Joy today. Joy's story is a very interesting one, and we already are seeing a lot of progress. And I want those who are not following Jennifer to follow her and see how he's making progress and achieving a lot. And we're hoping that on the long run, it will be a big testimony of how much he will achieve and change his
Yeah,
world.
chief.
All right. So I'm going to
And
go to the next. Yeah, you want to say
one
something?
another yeah, another thing I noticed was when I came here, a lot of people like Joel, they are not potty trained. They're not able
Mhm,
to clean themselves. They're not even able to do some things for themselves. They're not able to feed. They can't
mhm,
write. They can't read. So even when they try to fix him in special school, they'll be like, is above the level he's supposed to be with in terms of education.
mhm,
So I'm just encouraging moms is not to give up on that child.
mhm,
Train the child exactly the same way you train every other child.
mhm,
My mom was a very great support because she was there from the beginning, and
mhm,
she struggled. She did the potty training to
mhm,
teach him how to be able to take care of himself, while my husband teach him how to clean himself up after the poo.
mhm,
So even get a community, if you can't do it on people that can help to support to do one or two teaching for you.
mhm,
The speech therapist helping calming. She was coming to the house to teach him for a while. She helped us to calm him down. Was very there. We employed one of the school teacher that was really very helpful. That lady,
mhm.
God bless her, she was the one that taught him how to
Yes.
write. So we
Mhm,
employed her to come to the house to
mhm,
continue that to back in the house. So
mhm.
just teach the child the same way you teach every other child. They can
Yeah.
actually grow and become do something.
Yeah, you will be very surprised at how much they can learn, how much they can do. They are very gifted. Okay. All right. Thank you very much, Jennifer. It take us to the next question. We've seen some children and you take them out. Suddenly they start throwing tantrum. And as a mom, you're very confused. You don't know how to handle it. Like they just start shouting. I've taken my little boy to the shop before, city center, and he got there and he wanted to pick everything, anything his hand touches. I want this, like, let's leave. And he start falling on the ground that he doesn't want to go. you know, I like how many things can you buy? And then I told myself, I'm not going to take this boy to city center again, never, never again. So how do you handle situations like that? If it's back at home, where how we handle church children, like you'll be able to set them straight. But in some certain situations here, like you how do you handle? What do you do when you have a child just suddenly start throwing tantrum when you go outside?
Well,
What do you do?
so well, in my situation with Joel, we hardly go out, first of all. But when we do, I take them out. And whenever I'm going out, I get myself ready. I make up well. I look like a very hot mom. And I am so senseless. Like I don't even pressurize myself. So when I take Joel to church, especially to church, and I take my children to church, you see them running away. Do I take Joel to church? And you see me wherever he's going to, I'm going with him. But walking around disturbing the whole place, I was just like in my head, we'll all deal with it today. Yeah, we
Mm-hmm.
are here today. Don't worry, I'm not going to be around all the time. I'm not going to come. I might not come in 2 weeks' time or in next 2, 3 weeks. But when you see us today, just know why. Yeah, and get ready to deal with us. That's just it. And I'm never embarrassed. It's stressful, so I eat well, arrange myself because they're waiting to carry now. It's a big boy now, so I'm ready to hold. Sometimes I just let him be. My
Yeah.
own is that don't run to the road.
Yeah.
There was a time, I think Christmas Eve, we went to church and he said he wants to pee. We went out to pee and they were praying and preaching. The word has started. So we're like, we can't go in. And he didn't even get it. Like, what do you mean I can't go in?
I
He
must
started
admit.
str- he started struggling, landed on the floor. Initially, I was holding him. And
Yeah.
the thing, somebody else joined me and was even trying to hold him too. And the next thing, the thing just clicked in my head. Why are you holding this boy? If he's going to pass down to his seat, will anybody arrest him? No.
Yeah.
And I just told the man, let him be. And the boy
Be
just went straight to his seat
and
and
sat
sat down and carried
down.
his book and stared right in. So why did I stop him in the
From
first place from moving? So
exactly.
most of the time, like I take him to the garden, when we go to children park, you see he's taking everybody's toy, and I'm just apologizing to the parent. That's all like, oh sorry, oh I'm sorry, ma.
Yeah.
That's all I do. I apologize to
Yeah.
them because I'm like, okay, well
Yeah.
yeah, or IST. Sometimes the park close to my house, everybody will just leave and leave. So my 4 kids will take over the whole place and they enjoy
Yeah.
themselves and too.
Yeah.
So when we take him to Asda, take him for shopping, he just pick
Mm.
everything. So
Mm.
immediately you tell him, don't pick this, the drama
Mm.
starts. I was like, there's no
Mm.
point. Pick all the things they have picked, go to the
Mm.
pay center, separate
Mm.
the things,
Mm.
separate it, separate them,
Mm.
separate the one you're buying from the ones they are not, and they are not
Mm.
buying, you are not buying. Pack your
Mm.
own, leave the rest in the basket and go away. But over time, I've just told myself that there's no point. I think life is in phases. So now we spend more time at home. We do church at home. I said
Mm.
bond with your siblings. They play a lot. We do a lot of games.
Mm.
We do a lot of stuff. So we
Mm.
don't go out. We don't go out so
Mm.
often
Yeah.
as we should normally. So that's
Yeah.
for us. Some people will be like, "Hey, why don't you just try?" No,
Mm.
it's to me it's stressful. I have to be ready. Like, okay, yes,
Mm.
I'm ready to do all the chasing
Mm.
and the because sometimes it can run
Mm.
to the road. So
Yeah.
not people that have normal children that you're worried about
Mm.
a normal child that
Mm.
might be scared of safety. I have a child
Mm.
that does not care about safety or whether he has to run to the
Mm.
road. So
Mm.
we just stay at
Yeah.
home and don't stress ourselves too much about
Yeah.
going out. So
Jennifer, to be honest, I really like the way you're handling the situation, handling everything, and you're so relaxed. You don't look worked up. You don't look like someone who is being stressed. So it's like you're just taking it as it comes, one thing at a time. You don't want to, because another thing
exactly,
is where
yeah.
we have mom who have this burnt out. They are so stressed. They are letting everything get to them. They are looking depressed. They're looking tired. They are not even dressing well. And you just told me that before you go out, you are dressing well. You make sure you're very, very well dressed, looking very good, and then you're calm. So that calmness must be in every mom who has kids that have got behavioral problem. If you have a child
Yeah.
that's got, you have to be calm. You don't need to be the hot temper type. You just have to remain calm as much as possible. Try to handle the situation as calmly as possible. You don't need to try to, if she had continued holding joy, it would have still continued and then escalated. But then the moment
Yeah.
she allowed him, just take time, let him be. Or like you said, you walk around with him. Oh, sorry, sorry, it has ended. So you don't need to like, oh, because of that, I can't do this, I can't deal with this.
Can't
I
do
like
that.
how you're
Yeah.
doing that, yes. And then you also take him out. It's good. You're not just holding him inside and say, because he's going to be have this behavior, I'll never take him out. Although there are times that you want to keep him in, but there are times you still feel, let's go out, let him see out.
Let's go. Yeah.
Yes, it's good. So you just know when to put those things out there and how to handle them. Thank you very much for all your answers so far. I believe these answers will help a lot of mothers dealing with similar situation out there, and it will also
Yeah.
help them change their perspective on how they handle their children. And thank you for
Yeah,
sharing this
very, very
information.
important.
It's very,
I've not said that it's easy. Yeah, so
yeah.
like the wave of depression will come, the wave of anger will come. Those
Yeah.
waves, those waves of will come. And but one
Mhm.
thing you ask yourself is that you are here, you're alone, and the only help you have is yourself and God. So
Mhm.
you ask yourself, is there any other thing you can do that
Mhm.
can make it better? So most of
Mhm.
the time I talk to myself every day. Like I give
Mhm.
myself words of encouragement every
Mhm.
day and tell myself that the only outcome I'm looking for is the future where they become independent.
Mhm.
I'm ready to face this battle I'm facing now, but
Mhm.
I'm just hoping for the outcome where they become independent, where he can be able to do it on his own.
Yeah.
They can be able to stand and live on their own.
Mm.
So I'm putting all this in place, struggle of day by day, like each day. I can say one thing 10 times.
Mhm.
Like, Joel, come inside, get inside the house, come inside the house, come inside the
Mhm.
house. There are two
Mhm.
ways, or I make a one long angry speech. Get inside the house now by the count
Mhm.
of five. One, two, three, four, and you see them running in.
Mm.
So, but gradually over time, you just have to keep repeating. You have to keep doing these steps over
Mm.
and over and over and over and over again.
Mm.
And I think that's someone came to my house once, and when she couldn't even stay in my house for 6 hours, she was jumping everywhere. Like, hey, they said, like, how are you so calm? And all these things are happening at the same time around you. I was
Mm.
laughing because I was like, nothing has actually happened yet.
That I've not seen before. It's even worse before,
Nothing
yeah.
has happened yet. So just here and she couldn't sit down. She was tensed all the time. She was scared and worried constantly. I was like, don't
Mm.
worry, just calm down. Nothing has happened yet. Just calm down and just that these children are God's children and He's taking care of them.
Mhm.
So, and
Yeah.
most of the time, all you have to do is be a parent. You are just a
Mhm.
caretaker. So,
Mhm.
just be the parent to that child. Just be their friend. Just talk
Yeah.
to them. Keep talking, keep
Mhm.
doing. It's not
Mhm.
easy. I would not tell
Mhm.
anybody that it is not. It is not.
Mhm.
But
Mhm.
it's something you have decided to do. But do it with love. Because if you don't do it with love, you will be
Mhm.
sad all the time. You'll be angry. You will
Mhm.
hate yourself. You will hate your
Mhm.
life. But
Mhm.
you have to do it with love. You have to
Mhm.
accept. I talk about my problems freely because it
Mhm.
frees me. I talk about them and I'm free and
Mhm.
I move on and I forget about the
Exactly.
one that happened the previous day. So you'll be
Exactly.
able to move on and you find yourself that you're able to exude joy all the time. And
Mhm.
when people see
You're
you,
not
all they
piling up
see,
burdens.
you are
Yeah.
not piling up, but when people see, all they see is the joy. Like what I tell myself
Mm.
whenever I go out, I try to my best to look glam and good, and
Mm.
because nobody's going to pay you money or dash you money for looking unkept or
Exactly. They're only
looking
going to look
stressed or
down on
looking
you.
happy. They only
Yeah.
look down on you. So nobody's
Mm-hmm.
going to tell you to give you reward or give you award to say, okay, you are too stressed or you can't cope. No. So nobody's going to
Yeah.
give you that. Just give yourself that encouragement every day, personal encouragement, and you see that each day you're able to carry on.
Thank you very much. Thank you. So let's really answer this question that was sent here by Rishis. She said, we have literally been treating malaria every month for my daughter, who is 1 year and 1 month. That's 13 months old now. And I thought it was due to her not sucking for long. She stopped at 4 months old. Please, how can we make her bathing water okay?
Mm,
So it's like her daughter
okay.
is having a frequent malaria infection, and I think she's beginning to think it's the water. All right, Riches, is that what you think?
Mm,
Riches, you can type something in the chat. Let's be sure we get your question.
okay. Maybe
Okay, so
what's
let's, yeah.
so first of all, it's not because the child did not suffer. Most of my kids, I think it's only my second daughter who sucked for up to a year. The others stopped at 4 months. Just started having teeth at 4 months, so it was biting me, and I was even lactating well. So the others stopped at 4 months. So with for the first 1 year when I had my son, we're practically bathing him with pure water. We're practically bathing him with pure water. Immediately we started using the tap water, he started falling sick. Immediately we started using the tap water, he was falling sick. And we even bought a cloth, all the taps and everything, put on the tap mouth and all that. And he was still falling sick. We're making his food with pure water. So we even felt maybe we overdid it at that time because we're giving him bottled water to drink and all that. So we felt that his immune system has not built up,
Sensitized.
sensitized. So immediately he got exposed. That was it. He was just sick every other month. So for malaria, you'll be surprised that malaria itself might be the least of your problem because you can control your mosquito net everywhere, net in your house, net in your door, this, wear them socks, long. So you'll be surprised that malaria itself might not be the issue. But
Mm-hmm.
that's water. That's water. So either the child has desensitization over time and the child will grow out of the sickness, but you have to do something about the water. I don't know, even if it's for you to pack out of the house, because I think that was the other option I had. Even if it's for you to pack out of where you are living and
Mm-hmm.
go to a place where you can get good water. When I came to UK, because it was my problem, it was a greatest concern to me. I had to rent a newly built house that I know that I can drink this water without feeling like it's going to cost me something or so. It was that bad. We had to move into a newly built house. So just because of water, because I knew what bad water has done to me. So if you have to move or if you have to do a pipe change, whatever it is you have to do, because so that thing they say what comes into us is what makes us sick. That thing that comes into you is what makes it, because you can avoid the drinking water, you can be able to boil, you can do all this you want to do, but the one they will come in contact with, because this is 1 year, a year and 1 month, so the child will be crawling around. We move to places in the house, and the child will see this water, the child will bathe with this water, they will drink it, they will do so. You can never be
Mm-hmm.
too sure
Okay.
where the problem is coming from in terms of
Mm-hmm.
water. But if you think also that okay, this child is always sick and it's not, it might not be malaria, take that child to the hospital. Let them run blood tests.
Mm-hmm.
Let them run blood tests like a general workup.
Mm-hmm.
Because for a child at this age to be sick all the time, so most of the time from the first 1 year, they are hardly sick because there's the protective blood that protect them from even once for having malaria in the first place. So take that child to the hospital, let them do a blood test to work up on him to just find out if there is something else that's causing the child that to be ill
Yeah.
all the time, especially their tonsils. Let them check, just check.
Thank you very much, Jennifer.
Thank you.
Thank you very much. So, Riches, I wanted us to be very clear about something. For the fact that water was making Jennifer's children sick does not mean that water will also make your children sick,
Make your child,
except
yeah.
you are very certain that you have bad water in your house. There are lots of things that can make a child sick. One is malaria. Two, it could just be cough and cold. It might be a viral infection. Three can be tonsillitis, like she has said, where you look at the child's throat and then the glands inside there are swollen, and sometimes there could be pus inside. It could be many different other things that can make a child sick. So don't fixate on water. So you
Oh,
have to be
water.
sure what kind of water is in my house. Is it bad water or is it good water? Are the people in my house, the children living in the same house with me, are they having similar recurrent illness? So if that's not the case, it might not just be water, it might just be recurrent malaria infection. So what you
Malaria
do to
infection.
ensure that you have good mosquito nets, insecticide, let's call it insecticide treated nets. So get that
Yeah.
particular type of net, put it around your bed or your baby's bed, and make sure your surrounding is clean, is not waterlogged. There are no bushes around that will encourage breeds of mosquitoes. So make sure of that. And then in terms of hygiene, make sure your child's hands are always clean. They are on the ground at this point in time
All
in
the
their life. So
time.
they are
Yeah.
always picking things and putting in their mouth and picking infection. So just try as much as possible to make sure that their hands are clean and everything. Another thing Jennifer mentioned that I was just reiterate is that usually during this period, they are beginning to get exposed to one infection or the other, and it can also help build their immunity. It sensitizes their immune system to generate um antibodies to fight this particular infection. So just might just be what is going on, your child getting used to things. But nevertheless, pay attention. If your child is unwell, take the child to the hospital. They can do a test. And if the test comes out and it's malaria, we're sure it's malaria. One common infection, one common symptom that water infection will cause for your child is vomiting and loose stools. So
Lose
if
too.
your
Yeah.
child is having vomiting and loose stools, yeah, most times it most likely water infection. But if your child is just having temperatures, probably not swallowing due to throat infection and the rest, it might not just be the water, it might be something else, and you have to find that. All right. Riches, I don't know if I've been able to answer your question, and if Jennifer has been able to reassure you, answer your questions as well. Okay, so she said we do blood tests before every treatment. Okay,
Okay.
does it always show
Positive.
malaria? Okay. Maybe does it always show malaria? If it's showing malaria, then malaria might be the problem.
The
Because
problem.
most
Yeah.
times, all the blood tests that you want to do to test for infection in Nigeria, I think the commonest type we usually do is malaria. If it's the full blood count and user and all those ones will not tell what is going on. And I know there's another test we usually do in Nigeria is a typhoid fever test. We're always doing typhoid fever test, even when it is not necessary, and they will
Yeah.
come and say the titer is very high. My child has got typhoid and it's really not necessary, so we don't really need to do all those tests. All right, I don't know if we've been able to answer your question today, Rishis. I don't know if Rish is still here, but no problem, it's fine. If we've not been able to answer your question, you can only send me a DM and I'm more than happy to answer your question. Jay, sweetheart, you have done more than enough. You have answered all the questions, you have chewed all the questions, you have been a very wonderful speaker, and I'm glad I invited you to my first ever live on Facebook. Thank you very much that it
Thank
was
you.
you I contacted, and we had all this positive answers and this reassurance to all our parents generally. Thank you very much. I really
Thank you.
appreciate it. Before we go, do you have any word of encouragement or advice to all mothers or fathers out there with regard to their children? Just general advice.
Okay, so general advice is first of all, there's no competition in life. So don't pressurize yourself. Don't try to make don't look at other people and say, okay, this person's child is this, and why is mine doing like this? Don't
Mm,
put yourself in that kind of situation at all. There's no competition. Then take care of your family. No two situations are the same.
mm-hmm,
So take care of your family right in front of you. No
mm,
two homes are the same. And always know that nothing is new under the sun.
mm,
Everything that is happening now has happened before, or even
mm-hmm,
worse, has happened to someone
mm-hmm,
was too. So nothing is new under the sun. And another thing, there is nothing impossible for God to do. Nothing
beautiful.
in that you think you have and is drowning you, is draining, just know that there's a God out there that is listening and is watching and is going to take care of it. Then
Thank
there
you.
is there's no point being sad. Anything you do, do with love, do with
Mm,
kindness. One important thing is that just show kindness to everyone. It's very important. A lot of people are very rude, very unkind, very unruly behaviors, and especially with this whole social media these days, a lot of people are really unkind, like words they say and things they do, and you are like, okay, what's going on? So
mm,
just be kind and be happy. Assume happiness, love is very important. That love you give to your children, they give you back. Like my kids out there, when you see them in school, by the time every day they run to us, and this when they see us close of school, they are shouting, "Mommy!" And just only then they give hugs and they are shouting, "Mommy, I love you." You see my daughter Joanna, "Mommy, I love you, mommy, I love you," all the
mm,
time. And you'll be wondering if we grew up here or we grew up in Nigeria or something.
mm,
And they are like, we are big on love in my house. Like, "Mommy, I love you." Like, no matter how you see your child, you are getting angry or worked up or something. And next thing, Joanna will just come to me and say, "Mommy, I love you." And she'll just smile.
mm,
And you will just come,
mm,
like, just be big on love. It's very
yeah.
important. Be
Mm,
big on love. And you see that gradually. And don't set goals that you're struggling to achieve. Don't set goals. Like there's this thing about, oh, my child must be the best thing. Don't set goals you'll be
mhm,
struggling to achieve. Always know that the best is not always the ones that do better. Just pray that your child, the outcome, by the time your child is independent, the
mhm,
outcome is great. Your
mm,
child is able to fulfill, like take care of themselves, grow, provide,
mm,
work, consistent. They are consistent in what they are
mhm,
doing. They
mhm,
are hardworking. They are able to meet up to goals,
mm,
start something, and they are able to finish. Those should be the
mhm,
things that you are pushing
mm,
for your child to be able to start something, to be able to finish it.
mhm,
Consistency for your child to be able to learn over
mhm,
time, no matter how long it takes them to learn a particular thing.
mm.
Like I was trying to teach my daughter how to tie knots today. God, I was almost running mad doing it. I had to.
Yeah.
She herself started crying, went back, but came back again, and
Mm,
got it right before, just
mm,
before we came for this class. So
mm,
like we repeated it over. So you have to do it with love. Sometimes when we teach, we get angry and you're like, okay, it's
mm,
okay, I beg, go. I don't want to do it again. But
mm.
just try your best as a parent. It's
Be
not easy.
patient. Yeah.
Just try. Just try. Any
Mm,
which way that you know that you can try. Just
mm,
try. It is not easy. And
mm,
I will tell you for sure that our life right now is not about raising funds or making
mm,
money. Our
mm,
life, my life right now is surrounded, is about mostly about my kids and
mm,
just having a work-life balance so I'm able to go to work, I'm able to study. I cannot tell you that I sat down to read my book and I'm preparing for an exam. No.
mm,
What I do every day, you see this earpiece on my ears. I
mm,
just play all my school, all my learning work. I'm
mm,
playing them, I'm bathing my children, I'm
mm,
cooking. That is how
mm,
I learn every day. But
mm,
I don't really have the time to sit down to read. I
mm,
just play all these things and I play them over and over again. And I notice
mm,
that when I'm trying to do questions, I'm able to answer them. I'm like, okay, God is
mhm,
doing something. Something is happening. So
mm,
let's just be there, pushing ourselves and don't pressure yourself with consistency. Like when they say
mm,
autism children, they live on routine. I'm
mm,
the most routineless person ever in this life. I don't know
mhm,
routine because I cannot be the same person the same day.
mhm.
Today I wake up, I'm strong and I'm able to meet that routine. But tomorrow I'm not. No, I want to wake
Yeah.
up eight. I want to wake up 8 o'clock or 10 o'clock on Saturday morning, please.
Mhm,
So
mhm,
routine, I don't meet up at all. When
mhm.
Joel comes and wants to play that his routine card on me, and I'm like, ball, calm down.
Yeah.
I can't meet up with routines, please. I can't. I can meet up, okay, school, do this, and I do.
Mm,
But some days you can be unwell too, so don't put yourself under pressure. Again, don't
yeah.
put yourself under pressure.
Thank
So
you very much. Thank you.
thank
In
you
fact,
so
I'm going to
much.
buy this. This your earphone? I like it. I'm going to buy it to also help my learning as well, help my life. Thank you very much. I really appreciate that you came in. I really appreciate all the stuff
Thank
that you
you.
you've put out there, and all the encouragement you've given to parents today, most especially telling your story to encourage mothers out there with who have got children with behavioral issues. Thank you very much. I really appreciate this. Thank you to
Thank you.
everyone who came and stayed. I'm just going to call names. Thank you very much, Rita. Thank you, Taye, once again. Thank you, Mommy Celestina. Thank you, Rishis. Thank you, Oga Jacob. Thank you,
Tom
Chairman,
Bra. I saw
Chairman,
Tom
Chairman.
Bratton.
God, it's up. Thank you. Thank you, everyone. God bless you.
Thank
Have a
you.
wonderful night. And then we did not only bring a mom here. We brought a doctor. I also brought a pastor. Come and see her giving a pastor talk. Thank you, Jennifer. I really appreciate you. God bless you. Bye, everyone.
Thank you.
The ending.
All
Bye.
right.
Mm.
Bye.
Mm.